Hello. Today there is really another very good news as far as COVID-19 vaccine is concerned. Pfizer, in its phase 3 trial that was conducted on about 43,000 people, quite a large number of subjects for a phase 3 trial. The result appeared to be very good in a way. 95% is the efficacy of COVID-19 vaccine. That is quite amazing. Earlier, their preliminary studies were suggesting about 90.5%, but now the final analysis is saying that it's 95% efficacious. That's quite interesting. On the other hand, there are also a large number of studies coming out for COVID-19, both in the medRxiv and bioRxiv, both peer-reviewed and non-peer-reviewed, peer-reviewed publications, nearing almost about 75,000 papers. Probably no disease has attracted such great in-depth investigation like COVID-19. And no disease in the history has attracted thorough, dedicated scientific research and search for a vaccine at this shortest period of time. I think that is a really unprecedented, as is the disease, so is the discovery of vaccine, and the studies on virus and the viral diseases also is increasing at an alarming pace, and large number, reams and reams of papers are being published. I was reading the other day that just the Wikipedia itself has put in nearly 65,000 people to garner and collect all the data that is happening for in the area of COVID-19 research. Of these many of the research papers, a few of them interesting papers have also come out for the last 1 week. One study by La Jolla University in California has revealed that the COVID-19 antibodies are quite active and vibrant after 9 months of infection. That's quite revealing, because earlier studies were saying that the antibodies slowly decline and decimate about at least the first line of defense of antibodies after 3 months, 4 months and things like that. But there was also a suggestion that the first line of antibody will lead to second line or the long-term immunity called cellular immunity, leading to B cell memory cells and the T cell response going to get activated. As and when the COVID strikes again, there is always a hidden army waiting like a Trojan horse in the bone marrow to strike and finish COVID-19. That appears to be the case. But now the current study says, yes, antibodies are quite active even after 8 months. That's a good news. There is another interesting study of this number of studies that has happened, is that the initial SARS, not the SARS-CoV-2, which has caused COVID-19, but the first SARS that happened in China in 2003 and vanished altogether in about 2005, they have done the studies of those people who were affected by SARS, the SARS-1. Though it was not called SARS-1, it was called just SARS. And they have found that the antibodies are still active after 17 years for SARS, the first SARS-1. So that also is a very, very interesting revelation, that the human body is all that weak, is not all that weak. We seems to be evolving in our own way. We may not be aware how we are evolving. But of course, the whole immunity revolves around, as they say, 3R. Recognize, react, and recover. Now, many people are wondering, also there are research papers, why Indians have fared slightly better, far better, one can say, than many of the developed countries. We can always say, of course, the 65 people aged 65, 60 and 65, above 65, are just about 8% in India, unlike about 20 to 25% in developed countries or in Japan. That is there. But even then, why are Indians, the case fatality rate is not all that high and people are recovering quite well? One of the reasons they say is that Indians have been exposed to myriad variety of microbes thanks to little bit of compromised hygiene, though that is not what we should advocate. So this 3R that we talk about, recognize, react and recover, that at this part of the world, in India, we seem to have we familiarized ourselves with the wider horizon of microbial milieu, microbiome, what they say today, large microbiome, the microbial world. Maybe we have been exposed very early in life. So our exposure has led to recognition of the enemy or whatever the virus, the good, bad and ugly, our body is able to recognize because we have been exposed. They normally say a stranger is a friend until we meet. So most of these, the microbial milieu out there in the world, we seem to have been familiarized far more better thanks to little bit less hygiene and sanitation. Whatever it is true that the Indian rate is high. Indian rate fatality rate is low. At the same time, it is also true the Africans are least affected in the world. Probably lowest per capita income, highest, what you can say is insanitary condition and unhygienic condition. Why are they doing better? Again, another study says that the Africans, thanks to their bit of insanitary and unhygienic condition, more than that, the worms in the stomach is applying the brake on cytokine storms. This is also very strange news. As all of you might be knowing that the COVID-19 mortality or death occurs less because of the virus or the virulence of the virus, but more so because the body is overreacting. Because of the overreaction of the body, our own autoimmune cells, what they call as a cytokine storm, that is what is creating a havoc in the lungs and in our system and leading to mortality. So, in a way, they are saying that in Africa, these worms, for their own survival in our stomach, are applying the brake on our overreactive immune system. That is also a strange way of looking at COVID-19. Number of papers have come out, and they seem to be suggesting that it could be because of the worms in one infestation in the stomach leading to less mortality and less fatality. So that could be the case. Of course, this other interesting study published in Nature magazine. Why are aged people? Normally they say children are vulnerable because their immunity is not developed. They are susceptible. The predisposition is very high among children for many illnesses and all that. But in case of COVID-19, the predisposition is very low among children, but very high. Vulnerability is high among the aged people. Again, the reason that they are saying, as you grow old, the naive cells, which means they're not well trained, but naive, but the naive ones are highly adaptable. There's a saying that health is all about never-ending adaptation with ever-changing environment. Probably the old are not able to adapt because what they say as a overtrained or properly trained or overreactive old immune cells is what is leading to cytokine storm. In the young with more naive cells, easily able to quickly adapt and react as befitting to the new virus. So I think these are all the new studies happening. Of course, the immunity itself, immunology itself is a science. There is a lot of dark matter. There's a lot of dark energy. What they say, dark matter is all about the unknown. Normally they say in science that there are known knowns and known unknowns, and there are unknown unknowns. Probably these unknown unknowns applies quite aptly to human immunology, in general immunology. Thank you.